Yeah, and please do chuck your emails into the chat. It's really great. This is all about connecting people up, so that'll be fab. Without further ado, I'm going to hand over to Amber, if you are ready, Amber. She's going to be our first speaker today. So thank you so much. And yes, Amber.
That is fine. Let me just make sure I've got... Right. Let's see. Can you see the presentation?
Yes, we can.
Yeah.
Not my notes. Okay, great. Okay. Oh, and now it's just moved. There we go. Okay. So, I need to go back to the beginning. I was just saying to Emily, I don't normally present on Zoom, so this is a new experience for me. I'm Teams all the way, so we'll see how this goes. I'm Amber, and I'm the relatively new Health and Environment Lead Advisor for the West Midlands. I cover Worcestershire, Warwickshire, Birmingham, and the Black Country, so that's my patch. And I'm going to be talking to you about how nature-based activities can support health and well-being, and how my role really relates to that. I know lots of you will have loads of knowledge around this already, but hopefully you'll learn something useful, or maybe even be able to connect me with contacts you have that could benefit from knowing this stuff. So yeah, first of all, you might wonder why Natural England are getting involved in getting people out into nature. We are a conservation organisation, so I think some people think that we just want to protect our places and that means keeping the people out. But actually we have 4 areas of work as part of our roadmap to nature recovery, and the health and environment work sits within the connecting people with nature part, but it obviously feeds into all 4 strands, and I think that all of them rely on a kind of intersection between people and nature in some way, because people can have very different ideas of what nature means to them, and so it's really important for us to understand what those are, and that helps us to understand how the two, so nature and people, can exist together and thrive together. So I just wanted to start with a little activity. As I said, nature can mean different things to different people. For me, I would say it's probably a place of calm if I'm feeling a bit overwhelmed. So I just wanted, in the chat box, if you pop in what words or phrases spring to mind when you think about nature. And this is really personal to you. It's really just for your own reflections. If we have time at the end, maybe we'll readdress it. But yeah, it's more for you. Just bearing in mind, I cannot see the chat at the moment, so I'll have a look back through probably when I finish the presentation. Okay, so here's a bit of health context for our work in Walsall specifically, and this is sort of where I'm basing my work on. I'm sure many of you are really familiar with this, so you can tune out while you write what nature means to you in the chat or whatever. So Walsall has lower than average life expectancy for England. 1 in 5 Walsall residents has a limiting health condition, and half of those people say that it limits them a lot. The 2019 Index of Multiple Deprivation ranks Walsall within the most deprived 10% of districts within the country, although 6 of the 167 neighbourhoods are the least deprived in England, so there's quite a disparity there. And so within our health and environment work at Natural England, we would probably look more closely at those more deprived neighbourhoods and look at the health inequalities within those and how nature could address them. And then lastly, Walsall has the higher than the national average of children living in low income households. And this is really key for us within the sphere of social prescribing, because children are one of the underrepresented groups within social prescribing services more generally. So it's really a factor that we would consider. Why am I telling you all of this? It's really important to understand these health inequalities because nature and health are inextricably linked. And for example, so mental health problems disproportionately affect more deprived areas. People living in deprived neighbourhoods are 10 times less likely to have the greenest spaces. So there's a link there. And then health inequalities can be managed through exposure to green space, and I'll explain more about how later. But this is really just to illustrate that it's really important that we're looking at how nature can be used to tackle health inequalities. And there are many ways that this can happen. So through research and external research and our own research, we found that nature connection and nature-based interventions can improve health in a variety of ways. So can improve health and well-being. I'll go through that more next. It can also relieve pressure on the NHS, for example, by reducing reattendance at GP practices. It can bring communities together that may not otherwise engage in activities together. And it can eventually, the idea is that it will help with nature's recovery, because if people can enjoy and understand nature, they're more likely to want to look after it. And research has shown that pro-environmental behaviours and attitudes do increase the higher someone's connection to nature. So this is why we think it's really important, and our work is really important. There are so many wide-reaching benefits, a lot of which I didn't really know about until I started the role. For example, increased exposure to green space and nature is linked to physical benefits such as these I've just put up. So that could be lower levels of type 2 diabetes, obesity, immune system function, and it can even reduce cognitive decline. And it's also found to more generally just provide more health and wellbeing benefits than indoor activities. So it shows the importance of looking to the outdoors. And then on the right there's some mental health benefits which nature can provide. So these include lower stress and faster recovery from mental health issues. This could be an increase in mental well-being and resilience and happiness. And then it obviously can improve social connection and therefore feelings of belonging. Oh, that wasn't meant to happen. There we go. So yeah, it's really not surprising that people can and do benefit from being prescribed nature specifically to address health and wellbeing issues. 1 in 5 GP appointments, I'm sure some of you probably know this, 1 in 5 GP appointments are actually for issues that cannot be resolved by medical treatment alone. And so green social prescribing is a tool that can connect people to those local non-clinical activities to help their health and wellbeing. So that could be care farming, community gardening, walking groups, or even cold water swimming. So I'll just pop that up there, just to let you have a little read quickly. Okay. So yeah, I've just got some examples up here of the different green and blue social prescribing activities that we've come across in our work. And also I would say it's really exciting when we see green and blue social prescribing connecting up with other disciplines. So like art, physical activity and heritage and culture, they fit really nicely together. And a lot of these activities, like crafting and things, are brilliant when they're taken outside as well. So just sort of, yeah, I'm sure you all know this. So yeah, I would really love to have time to have everyone explain what activities you offer. But if you do anything different to what's on the screen right now, could you please just pop them in the chat along with the name of your group or organisation? And that would be really useful for me. And then also, if you're not someone who's directly offering services, if you could just, if you know of anyone or you're looking to be able to refer people to particular activities, pop that in the chat too. I'm just going to leave these up here for a few seconds so that you don't have to listen to my voice. You can have a break from my voice for a minute. Just going to have a quick look at the chat. Oh, great. Thanks, everyone. Fantastic. Okay. There we go. So yeah, I've talked about what kinds of activities people can be referred into, but these are the referral routes into those. So that could be via multitude of ways. So this could be via GPs, community health services, advice centres, or it could even simply be self-referral. This is all part of a massive change in the NHS long-term plan towards personalised care. So that's just by delivering not just medical care, but also looking at what matters to the person. And social prescribing really helps people gain a sense of agency within their healthcare, and also a purpose and a connection to their local community, especially for those with low to moderate mental health needs. Many of the nature-based nature-based activity providers that we connect with actually have said that when people have joined onto the activities, they want to become part of the solution too. So they quite often will become volunteers for that organisation. So it just shows how well this system can work. Having said that, while green social prescribing is a fantastic tool for managing health and well-being, there are obviously difficulties and barriers to mainstreaming it, which is what we are working towards. For example, I'm sure many of you are very familiar with this, the financial difficulties and unsustainable funding streams, which make it really difficult to set up long-term referral options. We also need to be raising awareness amongst GPs and with the integrated care boards to sort of bring it closer to the communities it serves. And then also promoting green spaces closer to where people live, because transport's always listed as a really prominent barrier. And so if we can find those green spaces that are near to where people live, that can really help. So these are the kinds of barriers that Natural England are looking at to try and address. And it's all about connecting with the right players to make sure that things happen. Speaking of connection, so this is actually something that we think is really key to green social prescribing. And it's really to say that it's not about the contact. So it's not just about the time spent in nature. It's about nature connection. And there are found, so that just at the bottom here of the slide, there are 5 pathways to nature connection that we feel are really key. So for example, number 1, you've got through the 5 senses. So really you could touch, smell, you're looking at the nature around you, so you're really immersing yourself in that natural environment. And then also we've got meaning there, so really understanding what nature means to us and what emotions it evokes, which is kind of why I asked you about what nature means to you at the start, to start sort of teasing out that nature connection element. So yeah, this is just what we feel is really important, and it's, yeah, again, not just time spent in nature, it has to be meaningful time. So all of the activities that we're looking at or that we support, we try and really tease out that nature connection element. Okay, I promise I'm nearly finished. I think I'm all right for time. Am I, Emily?
Yeah, you're all good for time.
Yeah, cool. Okay. So yeah, we're not claiming to be the experts of how to do green social prescribing because we don't deliver the activities ourselves. But we do speak to a lot of people who are very experienced in the processes, and based on advice from various pieces of research that we've done and interactions that we've had, especially from our green social prescribing national pilots. These are just some of the considerations for green social prescribing providers or referrers to look at. So for example, on the left there, I've got, it's more geared towards the social prescribing link workers. I think, I'm not sure how many, I think there might just be one on the call. But yeah, so seeking transparency from activity providers, seeking that information about what the activities involve so that you can make appropriate referrals. And then obviously, potentially, if there is time, consider attending taster sessions, because then you can understand really what it all involves and whether it might be suitable for a patient. And then lastly, to help organisations understand how to contact their local link workers and make those connections much more easily and more efficient. And then on the right, we've got for nature-based providers, it's a really simple one, just consider basic mental health awareness training for the staff delivering activities. And then also seeking to understand how the referral pathways work in your local area and what link workers might be looking for in terms of referrals. And this is the kind of thing that we can support with, and why forums like this one, networks like this one, are so important. These are just some other considerations which have been found to lead to best practice in green social prescribing. A lot of these came out of evaluation from our green social prescribing pilots, which happened in 7 different areas across the country, and it had loads and loads of outcomes and evaluations, and this was just part of it. So for example, being really clear about what's being offered. So this could be in the form of, I've heard some great ideas about cheat sheets. So that can be just an A4 sheet of everything that a person can expect if they come along to an activity. Could include what clothes they need to wear, what available transport there might be, and the list goes on. So just really making somebody feel really comfortable to come along to a session, and not have to feel anxious about that side of it. Someone else that I've spoken to has actually they created a video of the site. So this was a community garden, and they did a video that they put on their website, which they were lucky enough to have. And this just made it really, really seamless for the person coming along to that activity. It was something that they didn't need to worry about because they were already semi-familiar with the site. Yeah, I'm not going to go through all of these because I think if you think they're going to be relevant to you, you can look back at them when Emily sends out the slides. But yeah, I just thought I'd pop those in there. And again, this is stuff that we can talk to you about. And if we don't have the answers, then we can put you in touch with somebody that might. Okay. And then finally, this is really just around what I can do to support you in green or blue social prescribing, aside from just sitting here and talking at you for 20 minutes about it. So the first one is accessing funding. Natural England don't have a big pot of money, unfortunately, that we can give out to groups. That would be great. But it's mainly about passing on external funding opportunities to groups that we work with. Occasionally, we do have funding that we can offer directly from Natural England, but this comes from things like underspend, so it's a bit ad hoc. But yeah, it's mainly when we come across funding that we think might be relevant for groups, we can then pass that on. Providing evidence and resources, we're constantly commissioning or publishing evidence that groups can use. This generally is a need from like the integrated care systems where they're trying to prove that green social prescribing works, so we're able to offer that evidence, but we also have resources and things around best practice and findings that from evaluation that other groups have used in activities, so we can pass that along as well. And then finally, I would say this is the bulk of my role, is really just connecting people across the sectors so that green social prescribing can grow and people can find out about best practice. It's really about making those links, like I said, between the main players and making sure that the right people are connected up to make things happen. And obviously, as we're not delivering activities, nor are we giving direct patient care, we feel like we're in a really great position and we have the time to kind of network more widely and make those needed connections. So yeah, please get in touch if you have any queries, or if you have any questions about what I've just presented, please let me know. That's it from me. Emily, if you could stop sharing from my end, and then I'd be happy to take any questions if anyone has any, or leave it till the end.